Yep, that'll be perfect. Well, good morning, everybody. Thank you very much for being here. We constantly keep working on things that are really, really important. For me, keep life simple. It's about kids, taxes, agriculture, and values, and everything that we work on stays real close to that. I'm going to spend a couple minutes just bragging a little bit about our team and maybe in particular Department of Health and Human Services, what we've done to improve kids' lives and their families. Really been exciting for Children and Family Services, where we've decreased the time to permanency for children in our protective system by 35 days, helping them find permanent homes quicker. Obviously, we've bragged a little bit here recently, but we're going to continue to keep bragging about fixing the registry that had been for developmental disability babies that had been 35 years long, over 2,700 babies. We have that down now to 700, and it'll be zero by 4th of July. So really excited about the impact for families across Nebraska. Want to reflect on what took place last year during the summer for the summer EBT program, where we implemented with the USDA what we called the Nebraska Way, where we put forth and worked in partnership with our grocers to help families get the best value for their $40 per month. It was dubbed the Nebraska Way, and many within the USDA was trying to duplicate that effort across the country. So I think today what we're talking about is another step that's really important to help kids and families. And I will be signing a letter of intent to the USDA asking that soda and energy drinks be omitted from the list of eligible purchases under the SNAP program. Sometimes it's hard to look in the mirror. I was stunned last fall when I was at Husker Harvest Days, and I was going through different booths, and the University of Nebraska has just an extraordinary tent and event, and talking about numbers of different issues. And one of them was helping with nutrition, helping Nebraskans understand nutrition. And they had a card that said obesity in Nebraska. I don't know what anybody would think would be the obesity rate in Nebraska, but our university says it's 7 out of 10. 7 out of 10 of us have obesity problems, which creates big problems. And as I have said for years and years, our obesity problems are a result of starving in the midst of plenty, where we take in tons of processed foods that gets our taste buds, and they've got nothing but carbohydrates and sugars. And we wake up 50 and 100 pounds overweight, and we're starving to death because we don't get any nutrients. So I think that it's really important that we step up where we can, and that's the purpose of the SNAP waiver, is that we quit giving our kids stuff that's not appropriate. As I've said forever and ever, the last time I checked, pop is not a food group. We need to make sure that all of our kids can be exposed to healthiest things that we can. So I think it's really important that our kids are consuming food that support their development, their strength in their bones, support healthy growth, boost their immunity, and prevent chronic disease. We all agree. We never want to give up on kids. We want to support our kids. No kid can fall through the cracks. So with that, I'm really grateful for the folks that are here. I'd like to introduce our CEO and Director of the Department of Health and Human Services, Steve Corsi. Thank you, Steve. Appreciate it.
Thank you, Governor. Thank you, Governor Pillen. It's an honor to be here, and it's a great honor to be on your team at the Department of Health and Human Services. Governor Pillen and I do have one slight disagreement with each other. We just had this conversation a few weeks ago, and we both believe that we have the best job in the state of Nebraska. We can continue to argue about that, I'm sure. When first accepting the job, I asked the governor what his top priorities were for the department. His immediate response was to protect kids. There was no hesitation. Through the previous actions he's already mentioned and the impactful decision he's making today, it is obvious that he's serious about making this one of his top priorities. The decision to omit harmful drinks from SNAP purchases is an important step toward helping children and families thrive and live a healthy life and have bright futures. This action will remove soda and energy drinks from SNAP purchases, and our Director of the Office of Economic Assistance, Shannon Grotrian, is going to go into further detail about that here in a few minutes. At DHHS, we're not only tasked with ensuring the immediate needs and safety of Nebraska youth, we also are interested in their long-term success. According to the National Institute of Health, children who drink high levels of soda are more likely to exhibit withdrawn behavior and attention problems. These effects were present even after accounting for an array of socio-demographic factors and psychosocial stressors. This is not ideal when the need to focus and concentrate is critical to learning. Additionally, long-term effects of high levels of sugar may include type 2 diabetes, tooth decay, heart disease, and bone health, just to name a few. Energy drinks are also harmful to kids. Due to a child's developing brain, decreased impulse control, and smaller body size, they are more susceptible to the effects and risks of caffeine. According to Johns Hopkins, children who consume caffeine may develop behavioral or mental health issues, including but not limited to increased aggression, anxiety, stress, or depression. At the end of the day, this action by the governor is about the health, well-being, and future of our children. As a clinician who has worked extensively with youth and children in private practice and as a school psychologist, I can attest that children who have healthier diets and are physically active tend to have better clinical and educational outcomes. I appreciate the governor's action today a lot, which supports the health and well-being of children and families and will fuel the future of wellness in our great state. Thank you, Governor Pillen, for protecting Nebraska's children.
Thank you, Dr. Coursey. And next, I'd like to thank Dr. Eric Sherman for being here. Eric is Chief Medical Officer of Charles Drew Health Center, and really grateful for you being here. Come on in.
Thank you, Governor Pillen, for the chance to be here today. So my name is Eric Sherman. I'm the Chief Medical Officer at Charles Drew Health Center. It's a federally qualified healthcare center in North Omaha. As a father of 3 girls and a pediatric endocrinologist who's worked with underserved, underinsured, and uninsured patients in both Missouri and North Omaha, I've personally seen the challenges that our families face. Everyone that I work with as Charles Drew is dedicated to improving health in our community. But this requires support from all stakeholders, including local, state, and federal authorities. It also requires buy-in from our patients, who must take ownership of their health habits, and from parents and guardians to set positive examples and to serve as role models for their children. Do some data for a little bit. The obesity epidemic is getting worse in the United States and worldwide. The prevalence of obesity is expected to increase from 2.1 billion people in 2021 to 3.8 billion by 2050. It's nearly 60% of the projected adult population. It's increasing in children and young adults as well. So the projected prevalence of obesity by 2050 will be 15.6% in patients aged 5 to 14 and 14.2% for those aged 15 to 24. The governor already went over the scope of the overweight and obesity epidemic in Nebraska, but the obesity rates are higher in minority patients, low-income families, and in patients with lower education levels. As a pediatric endocrinologist, I focus on secondary and tertiary prevention. These are patients that are already overweight and have health problems, health complications like type 2 diabetes, sleep apnea, and higher cholesterol. But the key is really primary prevention, making changes in people before they become overweight. How? It's lifestyle modification. The focus is on behaviors, encouraging physical activity, healthy food and drink choices, and healthy eating behaviors. So what does this mean in practice? I tell my patients to avoid sugar-sweetened beverages like soda. Instead, eat fresh fruits and vegetables and drink water and milk. Briefly turning to energy drinks, I'd echo what Dr. Coursey said. They're not recommended in children for several reasons. First, most exceed the recommended dose of caffeine in children. So that dose is 0 in patients 12 and younger. Adolescents 12 and 18, it's 100 milligrams of caffeine per day. And you'll see a lot of these drinks have 200 milligrams of caffeine. Caffeine can last up to 8 hours in children, And in addition, there's negative effects on the ability to fall asleep and stay asleep, the heart, so it can cause the heart rate to go up and it can increase blood pressure, and mental health. So it can lead to worsening anxiety and then worsening trouble concentrating at school. Close by saying this request to the USDA will ultimately make kids healthier in the state of Nebraska, and I appreciate Governor Pillen for his leadership, his willingness to make hard decisions, and for his support of federally qualified healthcare centers. Thank you, sir.
Thank you, Rick. And next we have Shannon Grotrin, who is Director of the Office of Economic Assistant. Shannon was the one that really spearheaded our Summary BT program and got it going the Nebraska way. Shannon, thank you.
Thank you, Governor Pillen. It's an honor to be here for this important announcement. The purpose of the Supplemental Nutrition Assistance Program, or SNAP, is to provide benefits to low-income families to supplement their grocery budget so they can afford the nutritious food essential to health and well-being. SNAP is a key component of the social safety net, aiming to ensure that low-income individuals and families have access to enough nutritious foods to meet their basic needs. SNAP is the largest nutrition assistance program in the nation. The program works by providing monthly benefits to eligible participants, which they can use to purchase food at authorized retailers. SNAP benefits are issued electronically via an EBT card. To be clear, this change will not impact any eligibility components of the SNAP program. No one will gain or lose eligibility benefits or see any amount of benefit changes due to this waiver. This will only make changes to what can be purchased with their EBT cards. I want to thank Governor Pillen for the opportunity to work on the implementation plan for this healthy SNAP waiver. We will partner with grocers to design a plan that will ensure that Nebraskans are able to maximize their SNAP dollars, ensuring access to healthy foods options. In addition, we will collaborate with our SNAP education partners to design a program the Nebraska way that expands outreach efforts and supports participants in accessing tools and resources to make informed, healthy choices. Me and my team are ready to hit the ground running and collaborate with our partners to develop this waiver and implementation plan. Thank you, Governor, for this opportunity to contribute to building a healthier Nebraska.
Thank you, Shannon. Thank you, Shannon. And next, I would really thrilled that Senator Hardin is here. Senator Hardin works his tail off like all other senators to make things better for Nebraskans, and Senator Hardin is chair of the Health and Human Services Committee. So thanks for being here, Senator, on your day off.
Thank you. If you go to the USDA website, on the SNAP page, it says this: putting healthy food within reach for those in need. Nebraska is calling out that healthy food part of that purpose statement. It's about soda pop. And so let's just be really honest. Soda pop is delicious. We all like it. Is it an enjoyable thing? Yes. Can it be a pretty thing? That can is really attractive. They put some time into that, didn't they? But is it a healthy thing? And the short answer to that is no, it's not. And so are we in fact putting a healthy food in front of the public? And short answer is no, but we're going to do something about that in Nebraska. We're just the second state to do that. West Virginia stood up to do it. About 8 or 9 other states will be following us in that endeavor. And so it's exciting to be a part of something that actually helps people to live better, feel better. Allow me to be Exhibit A. 30 years ago, I was 50 pounds heavier than I am right now. It took me approximately 2 years to change my lifestyle to get that done. I know that it can be difficult. So my heart breaks when I hear statistics like the one that the governor read at the outset of this press conference. If UNL is saying, wait a minute, 70% of us here in Nebraska are in a bad way, I believe them. I can also tell you that I work in the insurance industry. I work with actuaries all over the country and have done that for many decades. And any and all actuaries in the health world will tell you two things. If we could just get rid of obesity and tobacco, we would eliminate the vast majority of our health claims. So I'm very excited for this small step that we're taking to make sure that not only kids, but adults too, are directed in a way that help them, assist them in making better choices in this way. So thank you, Governor Pillen.
You're a great exhibit, Senator. That's awesome. And then I would like to thank Dr. Tesmer and Sherry Vinton for being here today. We'd be happy to open up for questions.
I know Senator Hargan mentioned West Virginia. Is there any precedence from USDA revoking this category from SNAP eligibility in a specific state?
I think that West Virginia has approached, and I think there's 8 or 9 other states after us that are asking for the waiver as well.
They done it?
There's rumors that they are, but haven't seen it yet. We're the second. Andrew?
Do you have any data on how much people use their SNAP benefits to purchase, pop some energy drinks?
The statistic that I saw, there are different ones depending on where you look, but the last statistic that, the question was, do we have any idea on the volume of, or the amount of pop or energy drinks that are purchased with SNAP cards? Is that correct? Okay. The most recent statistic that I saw said about 9.3%. It is the largest purchase category with SNAP EBT cards.
Governor, how would you respond to somebody that might say this is just limiting the choices of poor people and it's paternalistic?
I think what's most important is that we try to step up and help educate, help make sure that we make the right choices. We've gone through an evolution of time. This is a small step to make sure that kids drink more water than they do pop, and that we help get the best value. This is nothing more than an extension of what we did with the summary BT last year to say, look, if you come in for $40, here's a card, here's the best value you can possibly get. I think that it's really important, again, that we help and we make a difference. So, obviously kids are going to be able to get pop if that's what their preference, but the program won't allow it. Yes.
When will it go into effect?
I'm sorry, say it again.
When will it go into effect?
Yeah, Shannon will take that because she'll be spearheading it. Thank you.
Okay, so the question is, when will it go into effect? We'll be determining our implementation date as we work through our implementation plan, and once we have approval from FNS, we'll be able to make that announcement.
Has it gone into effect in West Virginia? Do you know?
I do not.
Say that again.
Has it gone into effect in West Virginia?
Could not tell you that. The question, if it went into effect in West Virginia, don't know that for sure. Andrew?
If your goal is to help prevent children from consuming soda, why not do something at the state level, like remove soda from vending machines in schools rather than go to the parents and ask them to, because do they think that only targets low-income people?
So the question simply is if you really believe this, why aren't you doing more than just targeting poor people? Is that? Yeah. Well, we're not targeting anybody other than making sure that we get as best investment with the dollars that are being utilized. Look, I listened to young people 18 months ago, and they told me the food they were getting from SNAP was junk. They showed me sacks of it. We're just trying to help. Yes.
Is there any plan to try and expand SNAP benefits to help afford healthier alternatives then?
The question is there any to help with SNAP benefits? I think what we're certainly trying to do is making sure that every dollar that we have for SNAP benefits is the best value for Nebraska kids to consume and improve their diets. Andrew?
Can you currently use SNAP to buy candy and potato chips? And is that something you also may look at, since they're not considered healthy as well?
Question is has most of the SNAP dollars being used to buy candy and chips and pop? And yeah, I think that's exactly the point of reason why we're here, is to improve, to make sure that those investments are helping our kids improve their diets, i.e. with the summer EBT, to help make sure we get great values and most nutrition things. If we don't start here, where do we?
Well, I mean, will you try to expand it to candy and chips and things like that, besides just pop?
Well, I think those are conversations for the future. As your governor, yeah, I'd like to make sure that not a dollar is spent on the sugars and carbohydrates so that we get nothing but the best value for our kids.
Is there a federal component of this? I mean, the slogan is similar to the federal one at the federal level. Did
So
they suggest this, or
so
are you working with them on it?
Yeah, so the question is, there federal, this goes through the USDA, and that's where the waiver, and I'll be signing a letter that'll go to Secretary Rollins here in a minute.
But, I mean, that's RFK's slogan too, Make America Healthy Again. So I was just asking whether that inspired this effort or had anything to do with this.
Well, I think if it's inspired the effort, I will tell you, I just can speak for myself. This effort got inspired by me when I met with young people talking about how horrible the SNAP program was, how insufficient it was, and how they were hungry. And that's what's inspired it from my seat. Anything else? All right, let's see here. I've got a letter to sign that is that will go to Madam Secretary Rollins addressing the issue, and that's dated April 7th for the Supplemental Nutrition Assistance Program, which today it provides assistance in Nebraska to approximately 75,000 households, about 152,000 individuals that receive SNAP benefits. And again, let me thank everybody for being here today. This is a big deal for our kids. Step in the right direction. Okay.